policy statement, the AAP cautions students drug testing is unsupported by scientific research and carries inherent dangers. Drug testing programs break down trust between students and administrations. They also carry inherent dangers of motivating some students to switch to drugs that will leave the system more quickly, like alcohol or drugs that do not show up in tests, such as inhalants or herbal concoctions. Currently, there is little evidence of the effectiveness of school-based testing in scientific laboratories, or even in literature. Goldberg ELT compared two schools, one of which implements a mandatory drug testing program for students and athletes, and others which do not. They found and followed up that the drugs are illicit drugs, but not alcohol was significantly lower among athletes who were drug tested. However, they also found that athletes who were drug tested experienced an increase in known risk factors for drug use, including increase in normative views of use, belief in lower risk of use, and poor attitudes towards school. Laboratory testing for drug abuse is technically complex procedure. To ensure the validity of specimens, urination must be directly observed, which is potentially embarrassing for students, and the procedure that involves all others as well. Or the collection must be used fairly complex and expensive and federally approved protocol, which involves documents of continuous change of custody and handling, and includes temperature testing and controls for alteration and dilution. Few schools will have sufficient staff with proper training that implement these costly procedures. And recent surveys of pediatricians, adolescents, and medicine specialists and family physicians found that few physicians will be able to help, because less than 25% of familiars with proper procedures, collections, and validations and determination use of urine drug tests. A key issue at heart here is drug testing dilemma is the lack of developmentally appropriate adolescent substance abuse and mental health treatment. Adequate resources for assessment and treatment must be available for students who have positive test results. However, many communications lack substance abuse treatment services dedicated to adolescents and adults. Substance abuse and treatment programs may be incorporated and effective for adolescents. Federal support for school-based drug testing should be included and allocated of all resources that will facilitate greater access to adolescent substance abuse and treatment. There are means to preventing drug use other than drug tests. The idea of prevention goes to the root of the drug problem. Other methods of difference are less inclusive, such as encouraging extracurricular activities, drug education, fostering better parental relations, tackling poverty and safety, and so on. Forced drug testing will only encourage further rebellion. Teenagers, especially drug-taking teenagers, are attracted by rebellion and chances of beating the system. Draconian. Big Brother-style tactics of random drug tests will only provoke resentment and encourage students to break the law. Peer pressure is increased as they unite against school authorities. Drug users will only turn to drugs and more difficult to test, such as designer drugs, or use of making agents before being tested. Education is the ultimate deterrent, not the random testing. If the prospect of running after dangerous dragons is not scary enough, the random drug test sounds like more fun. Random tests are ineffective. Testing randomly has a serious disadvantage. We are testing many students who clearly do not do drugs. Thus, we are wasting our and their time, money, because the tests are not particularly cheap. And what is even worse, we are able to catch only a very small number of students who actually do abide by the law. Innocent students do have something to fear: the violation of privacy and loss of dignity caused by drug tests. To sum it all up, I feel that we are not getting to the root of the cause. In order to do more, we need to provide better education to the schools and offer alternatives to the school and to the students. Humiliation and mistrust among adolescents is not going to help develop a future of mentally healthy adults. It's going to add to our growing mistrust as a community. We must all come together to fight this issue. We don't want to throw a wet blanket over it and hope for the best. This is not for the good of all of this. This is for the good of one. End quote. Of all tyrannies, a tyranny exercised for the good of its victims may be most oppressive. It may be better to live under robber barons than under omnipotent moral busybodies. The robber baron cruelty may sometimes sleep, but those who torment us for our own good will torment us without end, for they do not do so with the approval of their conscience.